Only see on 4. The South Texas health system is receiving some national attention after a study ranked the healthcare group one of the 50 most expensive hospitals in the country, charging uninsured and out-of-network patients more than 10 times the actual cost. Action 4's Brett Crandall shared the story of a patient who has dealt with this firsthand.
South Texas Health System owns Edinburgh Medical Center, McAllen Medical Center, and 2 freestanding ERs here in the valley. This study comes out at a time that hundreds of cases are pending against the hospital network for cases of fraudulent billing practices. 55-year-old Majid Kofish ended up in Edinburgh Regional Medical Center for 66 days in the fall of 2013 to treat gangrene in his foot. Uninsured, Majid was concerned how he would pay when he checked in.
I told them right front, I said, look, I do not have insurance. And then they said, oh, don't worry, Mr. Kofash, Medicaid will take care of you.
But after his surgery, Medicaid denied him coverage. After losing his toe, the hospital offered him a $12,000 settlement, but Majid didn't have the money.
I said, look, if I have a $12,000, I will pay, but I don't.
Soon after Majid was discharged, he was sent a bill of $330,000. 30 times the original amount they were telling me we want you to pay. And then you're out, you don't owe us nothing. Majid's attorney Michael Moore says hospital charges up to 1,000% is not uncommon.
We're finding they typically charge between 1,000 to 1,600% more than what Medicaid, Medicare, and private pay, i.e. Blue Cross, would pay for the exact same services.
Just compare what South Texas Health System pays Medicare versus what they bill an uninsured patient. In a statement, STHS argues the charge-to-cost ratios referenced in the article do not represent prices paid by patients for care provided. Charging different amounts than the cost of services is why many medical patients have a hard time understanding their bills.
There's no detailed bill telling you why or how it become $330.
Moore has hundreds of cases pending against STHS for price gouging. Although the Affordable Health Care Law has helped thousands of Texas families afford medical services, thousands more like Majid and his family don't qualify for the subsidies and live in a state that didn't expand Medicaid.
The most vulnerable people in our society, the uninsured, are the ones being mistreated.
Now Majid fears he will lose his 28-year-old Winter Texan budget towards business.
My bank, which I've been banking with them for the past 29 years, they refused to give me a loan.
If you don't have any insurance, then you're not going to get the protection. And if you don't get the protection, then you're going to be forced with this unadjusted medical bill. Either you pay it or they destroy your credit. It's your choice.
We did reach out to STHS regarding the pending lawsuits, but they said they could not comment due to litigation. In Edinburgh, Brett Crandall, Action 4 News.
All right, Brett, very interesting report there.